client has been suffering through an issue with numbness in his ring, middle, and pinky fingers on his left hand, which has been affecting his daily life intensely. He is a professional bass player who practices 6 days a week for up to 8 hours each day.
On top of non-stop practicing, due to his many years of bass playing, he has hyperextended the tendons in his wrists and his fingers, causing carpal tunnel syndrome and causing his shoulders to be uneven.
In order to play the bass effectively, our client has to use the muscles in his hand, known as the extrinsic muscles, which are located in the anterior and posterior parts of the forearm.
In addition, he has to use his intrinsic muscles, which are located within the hand itself. They are responsible for the fine motor functions of the hand.
He experiences these periods of numbness after he has been playing for an hour and sometimes in the middle of the night, when the numbness spreads up to his shoulder and his bicep-tricep area.
Because of this, it is likely that he has carpal tunnel syndrome, which is caused by repetitive motions over an extended period of time. This results in a pinched nerve that causes pain, numbness, and tingling.
It is most likely that his carpal tunnel is affecting the ulnar nerve, and it runs from the clavicle down through the arm, elbow, and wrist to the superior portion of the middle finger and all through the ring and pinky finger.
The ulnar nerves are branches that extend from the cervical nerve, and it controls the medial muscles in your arms as well as the skin on your ring and pinky fingers. It passes between the olecranon and the medial epicondyle of the humerus. However, these muscles are not affected.
Due to symptoms of numbness in his ring, pinky, and half of his middle finger, as well as part of his back and clavicle, we can assume that the ulnar nerve is being pinched slightly inferior to the clavicle and is medial to the shoulder, so like right here.
Carpal tunnel is very common among upright bass players, and there are many ways to attempt to treat it today. The first form of treatment is physical therapy. This includes stretching, massage, and an adjustment in your activities to accommodate your pinched nerve wherever it is. The second type of treatment is open carpal tunnel release surgery.
During open carpal tunnel release surgery, the transverse carpal ligament is cut, which releases pressure on the median nerve and relieves the symptoms of carpal tunnel syndrome. However, people who have undergone open carpal tunnel surgery have regularly reported that their symptoms have started to come back after as little as 2 years.
Because of this, and the long recovery time associated with the surgery that wouldn't be conducted to Rob's musician life, the best course of action to help him would be physical therapy. So we had to come up with some exercises that will help to relieve Rob's pain.
Many of these exercises are fairly simple and only involve the stretching of the hand, arm, and neck. For our first exercise, the patient starts with his palm facing upward with his elbow bent. He should bring his wrist all the way to his shoulder and then extend his arm again. This should be repeated between 5 to 10 times. This will pull the nerve back and forth, creating tension. For another exercise, what the client will need to do is make a fist, then extend his fingers fully, repeating this 5 to 10 times, 3 times a day.
As another exercise for our client, he must extend his arm with his palm facing up and then with his other hand, gently pull his fingers toward his body. All of the exercises mentioned so far are a form of stretching known as nerve flossing. Nerve flossing helps to restore the motion between a nerve and its surrounding soft tissues.
One more exercise for Rob is similar to the one just mentioned. For this last nerve flossing exercise, the client will extend his arm like before, but this time he will gently pull his thumb towards his body until he feels a stretch in his form. Rob should repeat some of these exercises throughout the day for the most relief. In order to prolong his bass playing, our client should consider taking breaks more frequently, which will help with his pain and his numbness.
As a bassist, it is required to stand in a position that is unnatural for the body, which has caused our client's shoulder to become uneven. When you play the bass, you tilt your body to the left in order to curl your fingers properly around the neck of the bass and make chords.
Because Rob has been playing 8 hours every day, 6 days a week, his shoulders have been skewed to the left. In order to correct this process, Rob needs to strengthen the muscles on the right side of his body that correspond with the muscles that he uses when he plays bass.
One of these muscles is the deltoid muscle. The deltoid muscle is a rounded triangular muscle located on the superior portion of the shoulder. The deltoid is attached by tendons to the skeleton at the clavicle, scapula, and humerus.
Rob needs to exercise his right deltoid in order to attain balance in his posture. One exercise that is really good for strengthening deltoid muscles is the wall flex. The first thing to do is stand next to a wall with your back and elbows straight. Next, gently push your arm to the side against the wall as hard as possible and comfortable without pain. Hold for 5 seconds and repeat 10 times.
Rob could strengthen his right deltoid by using a resistance band. Begin this exercise standing with your back straight, holding a resistance band as demonstrated. Slowly raise your arm to the level of your shoulder, keeping your arm and back straight. Then slowly lower it back down. Perform 3 sets of 10 repetitions, provided the exercise is pain-free.
The second muscle that Rob needs to strengthen is the pectoralis minor. The pectoralis minor muscle is the smaller of the 2 sets of muscles that connect the bones of the chest to the shoulder and upper arm. It sits in the axilla and is inferior to the pectoralis major.
An exercise that is really effective to strengthen the pectoralis minor is the weighted push-up. First, start in a push-up position with your hands about 6 inches apart. Add resistance by wearing a weighted vest or have a training partner place a weight or sandbag on your back. Slowly lower your chest to the ground and press back up until you fully extend your elbows. Repeat 5 times, then rest 30 seconds and repeat 10 times.
The second exercise that Rob should do to strengthen his pectoralis is the pectoralis minor dip. First, grab the handles of a dip machine or a chair, making sure that your knees are bent to a 90-degree angle and your lower legs are overlapping. Lean your torso forward slightly and lower your body until your upper arms and the ground are parallel. Perform 8 to 10 sets of 12 repetitions of this exercise.
If Rob completes all of these exercises, and he does all of them every day, he should start to see results within a few weeks.